Hello, good evening, and welcome to the Functional Solution podcast and class brought to you by the American Academy of Functional Health. My name is Tal. I'm the educational director, and with us we have Dr. Esha.
Hi, everyone. It's nice to be with you all tonight. Hey, Dr. Tal, how are you doing?
Good to see you. And it's wonderful to be here. And if you're in this podcast, as usual, we're going to talk about root causes. In other terms, functional medicine. We're going to utilize some of the integrative medicine approaches. And so if you're interested in learning more about the root causes of chronic conditions beyond what they teach in medical or nursing or other programs, you are in the right place at the right time. So today we're going to have a discussion about food reactions in autoimmune conditions. And over the years, we've seen so many different types of immune reactions. And one of the major reasons why both me and Dr. Esha are doing these classes are because Dr. Esha has years of clinical experience and teaching and mentoring healthcare practitioners, seeing a lot of functional labs. And so we're bringing together our years of clinical experience to share with you what works, what doesn't work, what, at least from our perspective, and what are the clinical studies and the evidence is really showing us about how we can help our patients, right?
Yeah, I'm really excited to talk about this topic. I feel like it's such a big topic in functional medicine. I feel like food and autoimmunity and all the things around kind of the immune picture, immune reactions to food. So this will be a really big one.
Absolutely. And when we talk about autoimmunity, there's obviously there's so many ways we can talk about autoimmunity and the root causes, right? We covered autoimmunity from the gut health perspective, integrity, function, microbiome, the ecosystem. We've talked about autoimmunity in the advanced functional medicine program. We talk a lot about autoimmunity from the dietary aspects of what patients are eating to flare up their condition unknowingly, right? And then we also talked about it from environmental exposure or cellular processes and what it is that we can do and also test, right? The advanced functional medicine tests for each one of those. But here we wanted to talk about autoimmunity from a whole different perspective, which is the reaction to foods. And as you're going to see today during our class discussion, is you're going to see that identifying your patient's reaction to food is not as straightforward as you were previously taught, right? There are so many different ways to identify those reactions, and we're going to cover a few of them today. Now, we can talk by itself, food reactivity. We have like a whole module just on food reactivity. And we can probably spend a whole day talking just about the different reactions and how to test each one of them and how to identify and all of that. But we wanted to focus on the food reactivity for autoimmune conditions. And the main reason is because autoimmune conditions are so prevalent. There's nearly 25 million people in the US that are struggling with autoimmune conditions. Many patients report that certain foods worsen their symptoms, right? So there's patients that don't know, a lot of them, and there are some patients who already start to make that connection between they ate something and then it flare-ups their joint pain, their skin condition, fatigue, digestion upset, right? But here's the challenge. Navigating you as a healthcare practitioner, especially where they come to seek you for answers, it's really hard to navigate food triggers in autoimmune conditions because it's not always straightforward, right? There's an acute reaction and then there's a delayed reaction, right? It's really hard to understand that. And this is really, from what we're going to show you, some of the clinical studies, one of the most important factors when you work with an autoimmune patient, because because the proteins that we're exposed to can trigger all sorts of immune reactions. Some of them could be harmful. Some of it can stimulate more inflammatory pathways. And so we're going to talk about today immune reactivity. We're going to talk about intolerances. We're going to talk about food sensitivities. And as usual, we'll try to give you as much as practical and clinically applied information so you can learn, understand the mechanism, and already tomorrow morning, already start using what you're learning. And of course, we're also going to cover one of the functional labs that most people don't talk about, but we're going to show you how the science of food reactivity and other methods of testing for food reactivity. Now we know that that autoimmune conditions, and this is one of the major reasons we want to talk about food reactivity for autoimmune conditions, is because there's a significant increase in the prevalence of autoimmune conditions. So let's bring up this really interesting picture. This was published in 2010 in the journal Arthritis and Rheumatism. And you can see here the sharp increase of multiple autoimmune conditions, from multiple sclerosis, a very sharp increase from 1950. There's also a sharp increase in type 1 diabetes, also asthma, also Crohn's disease, right? And I brought this to you simply as an example for how many of those conditions. Now, there are obviously multiple mechanisms that we discuss, right? Now, this is again also another interesting chart, because we always discuss the genetics versus the environment, right? And there's still a very strong notion among medical professionals. I've actually heard that for over 20 years in healthcare. I heard patients that come in and I asked them, did anybody ever told you why you developed this disease, right? And they say, oh, my doctor told me that it's genetic. And I always had to explain to them that while the genetic gifts, let's call it gifts, right, that they get from their parents or grandparents definitely play a role, right? That's the predisposition. There's something got to be there to turn, and that's very general terms, right? But there's typically something that turns on the light switch, right? Turn on the genes of the disease. And our job in functional and integrative medicine practitioners who have more of a holistic view of things is to identify what it is that is triggering or contributing to their disease, their autoimmune disease, right? So our genetic has really not changed that much, right? Not changed in the last, 125 years, right? But our environment has, right? The foods that we eat have changed. And you can clearly see that in this graph, right? Where you see this sharp increase from 1950s. Now, obviously, some might say, well, we got better at diagnosing those diseases. We got better technology, right? And that's all true. But there's a very sharp trend. So here's some more interesting statistics. According to the National Health Council, the autonuclear antibodies, right, which is a common biomarker of autoimmunity, nearly doubled from 1988 to 2012 among teenagers aged 12 to 18. This is an increase of nearly 300%, right? When you even just look at the general prevalence of some of those diseases, right? So, for example, the estimated number of people with multiple sclerosis worldwide increased by 30% just from 2013 to 2022, right? And the prevalence of inflammatory bowel disease increased by 46% from 2006 to 2021, right? So we're seeing sharp increases, not just from 1950 to the early 2000s, but we're also seeing significant increase in the last 20 and 30 years. And so as healthcare providers, we have to constantly pause whenever we get a second and think about the general concept of what is it that we can do, how can we go beyond a prescription, right, to help our patients in the long term, right? Because the statistics are showing that we're not doing that well when it comes to prevention, right? And there's definitely a lot more that we can do when it comes to guiding those patients towards better health, not just disease management, right? And Dr. Esha, I know that you have seen a lot of autoimmune conditions, so I'm so glad that we, get an opportunity to do this class.
Yeah, I'm excited about this. I've seen a ton of autoimmune conditions. I've seen a ton of the Crohn's, ulcerative colitis, and then just all the other ones that we commonly see, the lupus, the RA, and then also unspecified, right? We have so many patients that come in with high ANA levels, or their doctor is not really convinced on what type of autoimmune issue it is, because some of the other markers aren't as defined, but they know they have some autoimmune picture. So I think, the functional medicine, where we get a lot of those other autoimmune cases as well. And this is such a topic that is so important for teaching our patients how to manage their autoimmunity through managing kind of dietary picture. So yeah, I see a lot of that. I'm sure you see a lot of it too.
Yeah, we've seen a lot of one common sentence that we used to hear was, you're the last resort, right?
Yep.
I used to hear it. I used to hear it so many times when I would have an autoimmune patient, and I do like the initial consultation because my practice is 100% cash, right? So we always try to do like a pre-treatment consultation, which in most cases we might even give the consultation for free. Give them like 10 to 15 minutes just to see if we're a good fit, right? Before we charge them anything, right? My personal philosophy, going through health challenges as a patient years ago when I was younger, and later on as a provider, is that I shouldn't charge them anything if I don't believe that we're a good fit for each other, right? So I can at least help them and guide them, educate them, guide them towards better health, bring some benefit to their life, and for them to check me out and see if it's a good fit, right? So yes, we have seen, and like I said, a lot of them come in and they've seen the specialists, right? They've tried the medication. They're some are on their way or already on biologics, right? Which are very expensive. Some of these medications are very expensive.
Yeah, like $100,000 a year.
Yeah. Yeah. And I've seen patients that I've had two patients that, when I talk about autoimmunes and the challenge of autoimmune, I remember coming to me, and one of them was already in bankruptcy. They said they just can't afford the care, the overall care that they need for themselves. The whole family was involved in it. So we have to think about what's the result of not getting the right guidance, right? And the result is not just loss of function. The result is also sometimes financial devastation.
Yeah, that's true.
For the whole family. So this is why your guidance and all the practitioners, each one of you who watching this, could be a pivotal moment in some patients' lives forever, right? Where you show them a different path, right? So that's why it's so important. So is there what else you wanted to add, Dr. Esha? I know it is a big topic. What else did you wanted to add on top of that?
Yeah, totally. I was going to add that, according to the National Institute of Allergy and Infectious Disease, kind of piggybacking on what you were discussing, approximately 8% of Americans have an autoimmune disorder, right? So around that 25 million mark. Both genetics and environment play a role. Genetics account for 30% of autoimmune disorders, and then the other 70% are said to be attributed to environmental factors, right? So things that may be in our control, our diet, our lifestyle, our environment, things of that nature. So even more so, space for the functional medicine world to kind of jump in and really help these patients out. Let's look at this really cool image. I think this is the coolest image of the entire hour segment we have. This is a cord diagram. It may be small. I'm not sure how big it is on you guys' screen, but it's a cord diagram from the 2022 Journal of Clinical Medicine, just demonstrating different autoimmune disease associations. So even more so why what we do is so important, because when a patient has one autoimmune disorder, they're already at risk for other autoimmune disorders, right? So we commonly think of rheumatoid arthritis, their multiple sclerosis, the IBD, the lupus, the more common ones that are talked about, but they're said to be, it's estimated to be between 80 and 150 different autoimmune disorders. So this image kind of gives us a glimpse into that, and then all these connections and risk associations between other autoimmune issues. So whenever you get the chance, if you wanted to look at that study and find the image, you'll see kind of these cords that are being drawn from one node to the next node. So one disorder to another disorder. So for example, when patients have like inflammatory bowel disease, they are at increased risk of an extraintestinal manifestation. So a disorder outside the gut, like uveitis, which is inflammation of the middle layer of the eye, right? So having one autoimmune disorder puts you at risk for other ones. Having celiac, right, puts you at risk for other autoimmune disorders down the line. So it's definitely something we want to think about when we target our patients, kind of really nurturing and taking care of them, because you're turning down the volume on one picture, but you're also unknowingly turning down the volume on other pictures that could develop had they, continue to go down this trajectory unmanaged, from at least from a functional medicine perspective. So I'm curious, Dr. Tall, before we hop into the next topic, when you see patients with autoimmune disorders, which I have, they usually present with other autoimmune issues as well, right? So celiac patients, thyroid issues, or like the ulcerative colitis patients who have other autoimmune issues. Is that something common that you've seen too, just a big inflammatory autoimmune soup happening in the body?
Yeah, that's right. So we know from the journal reports or published studies that when you have one type of autoimmune, you have significant increase risk of developing another one, right? And that's simply in the most simple terms, of course, is because once you have chronic inflammation, it can, depending on your genetic predisposition or your lifestyle, it can attack other organs in our body, right? And that's something that I always used to explain to patients, because I want them to understand what's going on in their body, and I want them also to. It also helps me as a point to emphasize the importance of really identifying what's causing it, so we can prevent the ongoing damage. One thing that I'll mention about the food reaction to food, immunological reaction to food. When I first started, in the first few years of sort of applying with my team in my practice the functional medicine principles to help patients improve their health, I saw really good results. Like, going into, especially with the academy's teaching, I was in the first class. I sat down in the first class of the academy, and it was just phenomenal how it was so straightforward, clinical of the gut, and here's what you're doing, and here's the principles, and here's the test, and here's the the treatment protocols, and then the environment, and cellular dysfunction, and the functional immunology. Everything was so both interesting and very applicable. And I applied everything, and I got great results. Right, patients come back 3 months later, 6 months later, and they say, "Oh, like this changed, my energy increased, I sleep at night, right?" Stuff that they've never. I don't think that they've never, at least from what they share with me, right? They've never experienced before when they went through other medical treatments, right? And this was not a drug-dependent change, right? This was not a temporary thing that once they stop taking the drug, the symptoms come back, right? It was a truly an improvement in towards health, right? Because they knew it, because some of them needed less drugs, less steroids, less this, and they still kept getting better in terms of their report, right? Their symptoms improving. But what was really interesting is once we started digging deeper and deeper into the different types of reactions, right? Because we teach them about healthy diet, we teach them the principles of the anti-inflammatory and all that stuff we talked about previously. But there were a few patients that I order the food reactivity test, especially one of them that I'm going to talk about in a few minutes. And one of them was an MS patient. This was a relatively young patient, and he already knew he has MS, and he was relatively functioning, right? So he was functioning, he had a job, and like if you looked at him, you wouldn't tell that he's got any neurological deficiencies, but there were symptoms, right? There were symptoms that he was reporting, and he got an MRI, and it showed, like you could see that he had a diagnosis of, like, it was noticeable. And what we did is we, of course, applied the principles. We ordered this specific lab test, and I asked him about the foods that he was eating and the associated symptoms, and we decided we're going to order this lab. And the lab came back. He looked at it and said, "Oh, interesting. This is some of the foods that I've been eating." And I said, "Well, this looks like you have. It's probable." Right, it's more likely that you have a certain reaction, and I'm going to explain about that test, what it does and what it tests. And he said, but I tested food allergies and it didn't show those. And I was like, yeah, this is a different method of testing, right? That's testing a different branch of your immune system. And we decided we're just going to take off the foods that were on the severe reaction or moderate reaction, right? And I said, let's just take it out for 6 months. Right, let's just take it out for 6 months. We'll work on some alternatives to those, and it wasn't a lot. I think it was like 4 or 5 foods, and he took it off completely from his diet. Right, I kept seeing him once a month, and then he came back 6 months later. He said, "I'm going into an MRI soon." I said, "Okay, wonderful." Like he already had some symptomatic improvement. Came back 3 months later with an MRI. Right at that point, it's like what? It's like 8 or 9 months, about 9 months into it. Right after he took off those foods, and he said his neurologist was just shocked. He's like, the MRI showed improvement in comparison to the previous MRI.
Wow.
Right, so that was really interesting to see that, and
that's really impressive.
Yeah, it was really impressive, and to me, it was sort of like a proof. Right, because until I had encountered that situation, I was mostly relying on neurological patients' self-report. Right, it's like, oh, I have more energy, I can walk better, or I can move my arms and legs better, I can function cognitively better, or whatever it is. Right. But it wasn't until we actually saw it with the MRI that I was like, oh, there's like this is like hardcore evidence, right? Very objective evidence that what we're doing is moving things in the right direction, right?
Yeah.
So this is why I feel like it's so important for healthcare practitioners to understand this. And I know you're getting into it, so I just wanted to give that example.
No, that's a really great story, clinical pearl, especially with that objective MRI, imaging, right? So it would be beyond just symptomology. So thank you so much for sharing that with us. Okay, guys, let's talk about different types of reactions to foods. So we're going to start out by looking at this image from the 2024 Journal of Food Allergy. We're going to see different categorizations of adverse food reactions. These adverse food reactions are going to include true allergies, right? So those are your more IgE-mediated responses. You have intolerances, which typically involves an inability to metabolize, digest, or absorb a food component. Then you also have sensitivities, which is not really listed on this chart, but non-IgE mediated immune responses. So a food allergy, which I'm sure we're all kind of aware of, is a true allergy. It's IgE-mediated food reactions. They are immediate hypersensitivity responses driven by these IgE antibodies. Common triggers, we think of like peanut allergies or shellfish, tree nuts, milk, and eggs. And the symptoms typically occur within minutes to hours, and they may involve hives, swelling, respiratory distress, GI upset, cardiovascular effects, or even anaphylaxis. And then upon re-exposure, these IgE antibodies activate mast cells, basophils, and so forth, histamine and other mediators to drive a rapid onset of symptoms. So these are considered true allergies, and the treatment is basically avoidance of them. So this is what we're seeing in this image on the right, the food allergy picture, IgE mediated mixed, and kind of what that looks like and the different disorders associated with this. So EOE, eosinophilic esophagitis, And you see non-IgE mediated. So mixed kind of incorporates other immune cells as well, not independently just IgE. But I would definitely say these are more like food allergies versus like food intolerances or food sensitivities. So non-immune food intolerances are going to be mediated, or well, not mediated by the immune system. So these are going to be intolerances that arise from enzyme deficiency. So I think like lactose, fructose intolerance, right? So don't have the lactase or fructase enzymes. So those are intolerances or sensitivities to chemicals like caffeine or artificial sweeteners, MSG, preservatives, things like that. Actual chemical intolerances. Symptoms can appear over hours to days and may include bloating, gas, diarrhea, headaches, or fatigue. While they're not life-threatening, they can significantly impact the quality of life. And management usually involves just supporting that specific component. So digestive support, avoiding the triggers, avoiding certain ingredients. Now, food intolerances may also be mediated by various non-IgE immune cells. So in functional medicine, you don't see on this chart IgG or IgA mediated food reactions, but we're going to talk about those. So the IgA and IgG mediated food reactions are delayed hypersensitivity responses, whereas IgE is immediate. So delayed meaning occurring hours to days after the exposure. In the integrative medicine, functional medicine world, we oftentimes will do food allergy testing, and we're looking to see what comes back, the amount that comes back, the intensity. We're kind of thinking about gut barrier dysfunction. And then IgA specifically is a part of the gut's mucosal defense. So anywhere where you have mucus lining, you'll have IgA there, kind of like I describe it to patients as like the security guard of the gut. But IgA in particular is a part of the gut's mucosal defenses, playing a role in mucosal immune activation, barrier integrity. So we think kind of like a classical example is celiac disease, right? Symptoms of IgG and IgA may include chronic digestive issues, fatigue, headaches, inflammation, joint pain, skin conditions. Now, when we think about testing, right, there's tons of food sensitivity testing in the functional world. IgG testing, it's something that, depending on who you talk to, functional medicine and conventional medicine, it remains controversial because sometimes the results are not always reproducible. And it raises the chicken or egg question, right? So is the disease state causing all of these IgG food reactions, or are the food reactions contributing to the disease? Interestingly enough, studies have shown higher rates and higher titers of food-specific IgG in inflammatory in autoimmune conditions like inflammatory bowel disease. And in one study, they also found significantly higher IgG positive titer rates in women compared to men, which kind of tracks with the autoimmune picture because autoimmune prevalence we see higher in women than in men. Now, from my clinical experience, because I've seen thousands and thousands of GI cases, like the whole gamut of GI people, and a lot of autoimmune included in that. When a patient has an autoimmune, like inflammatory bowel disease, Crohn's or colitis, I don't really run like any kind of food panel at the very beginning because everything is going to light up. Their gut is just so inflamed. So I find it's more worthwhile to kind of treat them, do some functional medicine approaches, and then later on follow up with like a food sensitivity test to see kind of what may still be happening. But for other like GI inflammatory autoimmune issues, I do think that they're useful up front, like at the beginning, like the MS picture, right? For example. But when you have a patient, I've done these on plenty of IBD patients, and I'm telling you, the whole test just lights up. And you can't tell a patient, don't eat anything on here. They're going to be limited to eating pickles, or something that nobody's going to eat all day. So I would say be very cautious about using them in inflammatory bowel disease patients at the very beginning, because they can just lead to eating disorder, honestly, and stress them out. But in all the other autoimmune pictures, I do find them useful. I remember I had this patient where they had they were seeing a rheumatologist, and like Dr. Tall said, we're kind of the last resort. They're like, I've seen all these doctors, nobody can tell me what's going on. Can you help me? So, they had autoimmune labs, ANA through the roof, other autoimmune markers, but none of them were specific enough to say, oh, this is an RA, or this is a lupus, or this is MS. So it was just more so they were told, let's retest you in a year and see if, something pops up there. And so we just did some food sensitivity testing and eliminated a lot of the larger trigger items, and this person's autoimmune picture significantly improved, their symptoms significantly improved. So I have seen tremendous value of using food sensitivity and food intolerance testing for this cohort of patients, autoimmune patients. I just wouldn't do it in the IBD patients right up front. So let's hop into a pop quiz. So on the topic of IgG and IgA, so IgG and IgA mediated food reactions are considered A, immediate hypersensitivity reactions, B, delayed hypersensitivity reactions, C, non-immune, D, always life-threatening, and then B is on there again, B, delayed hypersensitivity reactions. So the answer to this one is B, you guessed it, correct. A is the IgE, right? So IgG, IgA are more delayed hypersensitivity reactions. So Dr. Tall, I'm curious your thoughts on, food sensitivity, food allergy testing in the autoimmune cohort. If you've ever seen the test light up for IBD patients, or how do you approach that?
Yeah, that's a good question. I had... So I used to have a lot of discussions with colleagues and my mentor, who was great helpful for me, both setting up my clinical part of my practice and also my business aspect, like growing my practice. And I asked my mentor once about it, and it was really interesting. His answer was, been doing this for a long time. His answer was that every test, every one of those different tests, if you focus on IgE or IgA or whatever it is, or the next test that I'm going to show you, has a certain purpose, and it would be really helpful for the right situation and the right patient, right? Like pretty much. And I was like, okay, great, that makes sense, and that's a very could probably apply to every test out there, right? Yeah. so I don't think it was. I was like, okay, that's useful and not very useful, right? It's like, okay.
That's the nature of testing.
Exactly. But that's also, I feel like that's also in the world of really the part of the evaluation, right?
Yeah.
Learning functional and integrative medicine. It's like
the art of medicine.
Exactly. Yeah. There's so many different labs, and we don't want to order the wrong test and then tell patient one, if you order the wrong test, it's a lot of, you push the patient into a corner where they have lots of challenges and difficulties, especially when it comes to food, right? It's like, oh, by the way, you can't eat these 20 things that you like eating, that 10 of them is your major diet. It's like, what am I going to eat now, right? Yeah. So we don't want to cause discomfort to the patient. Plus, those labs are expensive, right? Yeah. So we always have to consider that, and that really one of the reasons why I always tell practitioners in our community is investing in your clinical skills is your best form of not just helping people, but also marketing. Because if you can help save your patient time, right, months or years of trying to figure out things and struggling, you can save them money and get them results faster. You become the person that they're going to talk about, right? That changed their lives.
Yeah.
So, and this is kind of, and this is also one of the reasons on the other side of if learning the mechanism, the more you invest in learning the mechanism, identifying and using the right labs, the better you can become, right? That's what we talk so much about it. But there's a good example is also of the other opposite is you mentioned the IgG test, right? And the IgG test is really interesting. When it came out, there's such a big buzz about it, I remember, and so many companies, lab companies were pushing it, right? As the go-to lab testing. And then, of course, if you talk to immunologists or an allergy specialist, they'll tell you that the IgG test, right? I even heard one of them that I talked to a while ago said, "Oh, it's a scam."
Mm-hmm.
And at first, I was like, "Wait a second," but it's there's like, was he right to say that? And then as we started diving, I saw more patients come in to me from other practitioners, and they would have the IgG lab testing. And I saw so many people, practitioners online, talk about the IgG test. And then there's IgG4 and all of that other stuff, right? So there's recent studies that show us that IgG test, and again, this is just my perspective and what I've been reading and what I've seen. And I had discussions with nutritionists who kind of specialize in functional medicine. And really that's what they do. They focus on food reactivity. And what we see is, at least what I notice, is that there's indications physiologically, we all have IgG antibodies to foods. Mm-hmm. Right? If you eat certain food more than others, you're going to have possibly higher antibodies of IgG. Now, does that mean that you have a reaction to it? Or does that mean that it's just a part of where your body works, your immune system works, and the way that your immune system eventually gets to tolerance, right? Mm-hmm. So it's not necessarily to say, oh, if this is high, it means that you have a reaction.
Right.
Reaction, right? Because everything we're exposed to is going to have an immune reaction, right? I mean, there's no way to eat food without getting an immune reaction. Mm-hmm. It's going to happen. But not all of it is negative. Most of it is not negative, right? So this is why, as a side note, from our perspective, I wouldn't recommend IgG testing, right? Because, again, there are studies that show that it's not a good marker. It's not a very reliable marker for food sensitivities, right?
I'm excited you're going to talk about the next test you're going to talk about, because when I very, very first started out in practice, I did an experiment on my own, and I had a patient come in and they just had tons of money and they just wanted to spend money on a lot of tests. So I'm like, well, let's just try this out. So we did a 2-week difference of an IgG test. They came in 1 week. Certain results came back. The next week, results weren't there. Other things came back, right? So it's really hard to sometimes reproduce those in certain patient populations. So I agree with you. And I had a mentor who gave me some advice also. And they said, if you don't know what you're doing, food sensitivity tests are an expensive way to create an eating disorder in patients. So that's what I always think about in knowing what you're doing in the art of medicine. So I'm excited to hear your next part.
Exactly. And I love that you mentioned that. This is, by the way, why we assign mentors to when you're going into the functional medicine, into this whole field of root cause, functional and integrative medicine that includes many things, including using herbs as a pharmacological agent, right? Now to address conditions and change your patient's physiology. Have a mentor, because you're threading into a field of medicine that you were not trained to do. So that's why I always say, always tell practitioners, especially nurses, nurse practitioners, physicians, pharmacists, PAs, I always tell them, we'll give you all the training, so you got the training, and then you have the certificate on the wall to show it. But having a mentor is really where you have somebody that guides you through the hands-on approach, right? So you're doing things right. So let's go into the topic that we wanted to talk about. And this is leukocyte activation. So in other words, ALA activation tests and food elimination in autoimmunity. So while most common food reactivity tests are focused on detection of levels of antibodies, such as IgG or an IgA or IgE, right? There is one test that could give us an additional information about the immune reaction without antibodies. So again, this is looking at the immune reaction from a different perspective. So it's almost like when you look at antibodies testing, you're looking at like one branch, very specific branch of the immune system, right? Now what we want to do is take 1 or 2 steps backwards and look at the whole picture and see, is there a different is there another reaction maybe here that I'm not seeing and I have not been trained or to pay attention on, right? And so leukocyte activation, or ALA, testing is being in clinical use for over 30 years. Its utility mostly explored primary through very small uncontrolled and retrospective studies. And I wanted to show you an illustration. This is an illustration from a published study. It was published in the journal Nutrition in 2018, Nutrition and Metabolism. And I put the citation on the right side, so you can find and read more about it if you want to. But essentially, it was published in 2018 in the journal Nutrition and Metabolism. And essentially, a positive leukocyte activation response is categorized by the intracellular protein kinase C activation, leading to the release of DNA and subsequent activation of peripheral blood innate immune cells. So I love this picture because it really simplifies the process in which shows us what it is we're actually looking at, right? So there is this response that you're looking at suggests that leukocyte activation testing might help to identify food antigens capable of provoking an inflammatory mediator release and innate immune cell activation. Therefore, it provides an insight into the potential food-related immune reactivity. So instead of looking at the antibodies against certain foods, we are looking at the reaction, right? The cellular reaction to contact with specific food proteins. Now, interestingly, you can measure over 100 different foods, and you'll be able to see what is the reaction. Now, this is where do you find this lab testing, right? And there's different ways. There's another study that I'll mention that they looked at this. One of them was a really, really interesting study that is called the efficiency of individualized diet in patients with irritable bowel syndrome. This was a randomized controlled trial and was published in 2017 in the BMJ Open Gastroenterology. And what they did, this was a double-blind parallel group randomized controlled trial. And what they did is they took two groups. One group had, they eliminated, right? They tested the leukocyte activation. They eliminated the foods that tested positive, meaning high reactivity, right? And allow foods that tested negative, right? That tested negative, which means non-reactive, right? And then the comparison group, they eliminated food that tested negative and allowed food that tested positive, right? Which is the opposite. They allowed food that it had an inflammatory reaction. And what they found is that patient followed this test, followed the elimination of the foods that were on the high scale, had significant clinical improvement in IBS symptoms. For example, they had less pain, less bloating, and less discomfort over 8 weeks, right? Also, inflammatory marker, which is neutrophil elastase, which is a blood marker of inflammation, significantly decreased in the intervention group, right? So this was really interesting. So where do you find this particular test? So this test is offered by, it's called ALCAT, and we're going to show this on the screen. And so when you see this test, there's a few really important factors to remember. So the first one, of course, is on the left side, you can see the severe reaction. And then you got moderate reaction, you got mild reaction, and then you got the negative reaction, right? Which means on the green, which means that there's no reaction, right? Now, how do they test this? This is a blood collection, right? A sample is sent out to the lab. Then in the lab, the white blood cells, the leukocytes, are exposed to a wide range of food extracts and chemical substances, right? So you can test for hundreds of items, right? And by the way, the two vendors that I would mention that have this specialty test in the United States, they have on their website, they got a detailed description of how, and there's like a video that describes how the computer system does all of that and expose the proteins in the petri dishes. So it's really cool to see that. Then cellular reaction is measured. So a computer measures the change in size and volume of white blood cells using an instrument called a flow cytometer or hematology analyzer. And if the cell change significantly, for example, it's a shrink, a swell, or a break apart, it's interrupted, it's interpreted as a sensitivity reaction or an immunological reaction, cellular immune reaction. Now, as I mentioned, there's from severe reaction to no reaction. Based on this, in data, you can consider with your patient what would be most appropriate, right? So for example, for my patients, I had very clear, and I'll give you this like pro tip, at least what worked for my patients, right? I would explain to them about the severe reaction and what is most likely happening in their body, right? So they have an immune reaction, immune cellular reaction, leukocyte reaction. I would recommend them to remove the severe foods completely, and if possible, replace the moderate and then reduce the consumption of the mild reaction, which is on yellow, right? Now, I always checked on them every month to see how they're doing. Typically within some patients within already 2 to 3 months report that there's improvement, sometimes very significant improvement. Now, I had patients 3 months, 6 months into it, they feel better, right? They get better, they have less inflammation, less reactivity. One thing that I wanted to mention is that when patient asked me, I had a few patients that asked me, they came in for like 6 months or a year check-in, and they're like, I was like, how are you doing with this, and this? And they're like, oh, I'm doing better since we talked. It's pretty much good. It's pretty much been good, much better. Now, can I go back to eating the foods on the severe list, right? And with 2 of my patients, I said, listen, maybe try in moderation and see what happens. If you get a reaction within a few days, stop eating those foods. And guess what happened? Those same 2 patients came back to me a month later. I saw them and I was like, okay, how did it work? Did you introduce those foods? And they say yes. And both of them said, I noticed that I had an aggravation in some of my symptoms. I said, okay. So they're like, so what should I do? And I'm like, well, in my opinion, you should not eat those foods. You should just look for alternatives. And they're like, for how long? And I said, as much as possible, possibly for the rest of your life, right? Now, I know that might sound harsh to some people, but our role sometimes as healthcare practitioners it's to educate patients, but not to sugarcoat it, right? It's really to show them what's harming their body. Now, it's their decision if they want to have a cheat day and have some fun, if it's their birthday or their kid's birthday and they want to have some fun and eat whatever they want. Okay, that's fine. But on a regular basis, we want our patients to know what's harmful for their body, what's the triggers, what's the contributors, and be smart about it, right? Take care of themselves so they get a long-term good results, right? Now, a couple of things that I wanted to mention. The ALKIT test is not the same as allergic testing, right? It's not. It does not involve antibodies, right? We don't measure intolerances, right? Like Dr. Aisha mentioned, it's not measuring glucose intolerance or lactose intolerance or whatever it is, right? We're not measuring issues with enzymatic production, right? Like pancreatic enzymes. So there's a lot of things that you have to understand in order to sit with a patient and look at the signs and symptoms and say, oh, like this is probably what's causing it, right? So we don't want to order this lab test. It's an expensive lab test. It can run between $250 to $600, depending on how many foods you want to test. But when it's indicated, I saw really good results with many patients. And one thing additionally to understand, there are a few interesting studies about it, about this particular study. I'm going to post here one of those studies that I was mentioning before, that they got really good results with IBS patients. So let's put that on the screen right now so you can see. This was published in 2017, BMJ Open Gastroenterology. You can read more about it. There are a few other studies that show the kind of discuss the effectiveness of this test. However, know that this is not an FDA-approved test for food allergy, right, or food reactivity, right? So this is important to know. This is, in my opinion, one of the best options. Again, as my mentor told me, I'm going to tell you, when it's indicated and you have eliminated other potential factors, right, that could cause your patient the autoimmunity, right? Now, one thing that me and Dr. Esha also wanted to mention, and that's going beyond leukocytes activation. There was a recent paper, the Journal of Foods, that discussed, this was 2025, so just recently. And I wanted to mention this because we always want to keep you updated with the current practices. And so this is a concept that I've learned about in already about 10 years ago, but the concept of molecular mimicry. And this is when a foreign antigen shares sufficient amino acid sequence similarly to sequence similarity with self peptides, right? That leads to cross-activation of autoreactive T and B cells and antibody production. So essentially, what does it mean in simple terms? It means that your immune system gets confused because something foreign, like a virus, bacteria, or even food protein, looks very much like your body's own tissue, right? So, for example, let's say you got a Hashimoto patient and you have already learned functional medicine, you work with a mentor, you are identifying the root causes, what's contributing, what's triggering their Hashimoto, their hypothyroidism, right? And they eat, let's say they eat gluten, and let's say their body particular, it could be gluten, it could be oats, it could be whatever, it could be oats or something like that. And let's say their body, their immune system, for some reason, right, looks at the protein of their oats or gluten, and the protein sequence seems to our immune system resembling the protein in the thyroid, right? What happens then, the immune system attacks the foreign protein, and it could also mistakenly attack the thyroid gland, leading to thyroid autoimmunity. So this is a big topic, and we're not going to discuss all the 6 different types of reactivity or cross-reactivity. But I want to give you this as an example for you to understand that. And I'll post here a citation for a study if you want to read more about it. This is a 12-month study, and gluten-free diet, for example, was shown to reduce thyroid-stimulating hormone in patients with chronic thyroiditis, right? There's another study that we looked at that showed that patients with inflammatory bowel disease had a symptomatic improvement and endoscopic improvement with specific elimination, food elimination. So there's a lot of different studies that are showing us that there are multiple mechanisms. So it's not just antibodies, that's just one part of it, right? The different antibodies. There's also the immune activation, which I talked about. I show you the lab test. I talked about the mechanism. I show you the illustration from the study. And then there's also molecular mimicry. And of course, if you want to learn more about each one of them and how to identify them, then log into the Advanced and Clinical Functional Medicine portal that we have for you, and also work with your mentor. This is great opportunity for you to bring cases of complex patients or chronic patients you have in your practice, and and discuss these with the mentor. All the mentors that we assign you have a lot of experience with functional, integrative, and primary care. So they're there and they can give you guidance on things that you might not see, right? In the same way that my mentor did for me and allowed me to get better clinical results. So now that we understand molecular mimicry and the immune activation, let's do a little pop quiz. So which of the following describes molecular mimicry the best? One is, or A, a deficiency of digestion enzymes causing food reaction. B, foreign antigen resembling self-peptides leading to immune cross-activity. C, the buildup of toxins in the bloodstream after eating certain foods. D, the inability of the gut to absorb key nutrients. So which one do you think it is? You should know the answer because we just talked about it. So which one of those describe best the concept of molecular mimicry? So the right answer is B. So as we mentioned, a foreign antigen resembles self-peptides leading to immune cross-reactivity. This is, by the way, if you're seeing chronic patients with inflammation, cardiovascular disease, metabolic, and autoimmune, this is why functional medicine is so helpful to really understand what's going on there, right? What's underneath the symptoms, right? So, so this is where log into your platform, reach out to us, connect with the mentors. We give you all the tools you need to be successful in your practice. So, Dr. Esha, I know that we got another interesting concept that we wanted to talk about.
Yeah, let's talk about some of the nutritional components of immune reactivity. So outside of just kind of the immune reactivity of foods, we can look at nutritional deficiencies that play a role in immune reactivity. So we're going to actually jump into another picture. This is an example from the image from the journal Nutrients, published in 2024. We're going to go through some of these stages here. So you see the numbers 1, 2, 3, and 4. So I'm going to walk you through those and we're going to talk about what's happening. And then the citation is there as well if you wanted to take a little bit of a deeper dive. So in this picture, overall, we see stages of macrophage reactivity in response to an antigen. So the first stage is activation. Then you have a migration. Number 2, you have the phagocytosis. And then 4 is the destruction of the engulfed antigens. And so in this image, a few things are happening. As you can see, it's really busy. To the upper left, you're going to see, upper left of the macrophage, you're going to see how pro-inflammatory signals such as your cytokines, you see your LPS, the little purple toll-like receptor, TLR over there, your interleukin receptors, respectively, are leading to the translocation of NF-kappa B to the nucleus. So you see the NF-kappa B in the red little peel icon. And that's leading to the nucleus, enhancing the transcription of pro-inflammatory genes. And then simultaneously, you'll see the cytosolic phospholipase A2 in the green peel icon right above the NF-KB. You'll see that one, it's releasing arachidonic acid. So at the very top, the arrow is going and pointing to that AA from the membrane phospholipids, which is metabolized by the COX-2 into prostaglandin E2. So the prostaglandin E2 is going to act in a paracrine manner through the prostaglandin E2 receptor, further activating the NF-KB and amplifying those inflammatory responses. So the cytokines produced, they reinforce pro-inflammatory activity by increasing oxidative stress and recruiting additional immune cells, thereby amplifying inflammation. So nutrients actually play a critical role in modulating these pathways, which can essentially modulate how we respond to antigens, food reactivity, and things of that nature. So in this picture, you'll see some of those important vitamins. So for example, Vitamin D. Clinically, vitamin D deficiency is linked with a higher risk of food allergies and an impaired gut barrier, which is really huge in autoimmunity. The mechanism is because vitamin D enhances antimicrobial peptides like defensins and the cathelicidins and suppress the NF-kappa B activity. So that's going to reduce that inflammatory cytokine signaling that we just walked through. Vitamin A and carotenoids. Clinically, they support mucosal immunity. So that's that IgA picture we talked about initially, balancing that T helper 1, T helper 2 response, which is critical in having an allergy versus a tolerance for a component. The mechanism specifically, vitamin A maintains epithelial integrity and modulates those toll-like receptor mediated signaling in macrophages to prevent excessive inflammation. Then we think about zinc, which we see in this image. Clinically, zinc is really important for gut barrier integrity. And a lot of gut barrier supplements and formulations, you always find zinc, or most of them you find zinc. I won't say always, but it's pretty essential for gut barrier integrity. And then when you have a deficiency, it can increase intestinal permeability, i.e. this leaky gut, which further perpetuates this antigen food exposure in the system. The mechanism is zinc acts as a cofactor for NADPH oxidase in macrophages, which enables controlled reactive oxygen species production during the engulfing of these components, which is called phagocytosis, while also stabilizing that inflammatory signaling response. And then we have two more. So selenium, which you see kind of in the middle of the image. Selenium is an antioxidant clinically and an immune modulator. It's linked to autoimmune thyroid disease, which often overlaps with food sensitivities. And the mechanism is because it powers glutathione peroxidase in macrophages. So just powering that is going to limit oxidative stress and dampen the NF-kappa B driven inflammation. So if you are kind of following along, you'll see a recurring theme is dampening or reducing that NF-kappa B kind of trigger, if you will. And then the last one is like omega-3 fatty acids. Clinically, they help resolve inflammation and reduce allergic hyperreactivity. And then mechanistically, they are going to compete with that arachidonic acid at the COX-2 pathway, shifting the eicosanoid production towards anti-inflammatory mediators like resolvins and protectins. And they're actually really interesting resolvin formulas available now outside of omega-3 formulas that are really interesting in terms of the autoimmune picture. So that's just one picture. We want you to kind of take a snapshot of this next picture. This is a chart we've prepared for you guys to review, so you can take a little screenshot of it with the breakdown of these nutrients. And we added some probiotics in here for the gut microbiome. So, when you think about your autoimmune patients, these are kind of simple no-brainers. I think vitamin D is something that needs to always be assessed. Vitamin D, the microbiome, zinc, selenium, omega-3s are a no-brainer. And then some of the other components we'll talk about in a bit, but just screenshot this so you have it as your clinical pearl guide, if you will, for just nutrients and immune responses and reactions. So let's pop into a pop quiz. How does vitamin A modulate immune function at the cellular level? A, by acting as a cofactor for NADPH oxidase. B, by maintaining epithelial integrity and modulating the toll-like receptor mediated signaling in macrophages. C, by increasing reactive oxygen species production indiscriminately. Or D, by depleting the Th1, T helper 1 responses entirely. So the answer, I feel like all of our answers have been the same letter this evening. The answer is B. By maintaining epithelial integrity and modulating toll-like receptor mediated signaling in the macrophages. So that's vitamin A specifically. And just remember, if you're interested in learning more about the functional medicine approach to autoimmune disease, which is really vast, along with functional integrative ways to support your patients' just immune health, log into your advanced and clinical functional medicine platform. You're also able to book a coaching call with us to review a specific case that you may be stuck on or need some support. And we can kind of help you offer functional medicine right away. So this is a part of your program and it doesn't cost you extra. So I hope you guys were able to screenshot that chart. So I think it's really helpful in guiding just a baseline where to get started sometimes with these autoimmune cases. And then Dr. Tall is going to talk about another really cool formulation that I love for autoimmune patients. But yeah, what do you think about those nutrients? Are those kind of areas you're always starting with your patients too?
Yeah, absolutely. That's exactly why we created this chart um, for everybody who is watching this and this class, and it's really to kind of understands the clinical relevance to it. So
Mm-hmm.
why is it that we would recommend this particular nutrient, if it's zinc or selenium or probiotics or omega-3, and then of course how it works, right? So those are the the
Yeah.
stuff that we focus on. Of course, when we dive into more advanced pathways and strategies, we talk more specifically about the dosages, because the dosages are very important. For
Right.
example,
Yep.
curcumin in a certain and a smaller amount, smaller dosage does physiologically different things than what it is in a higher dosage. So that's
Mm-hmm.
really interesting to see when we talk about antioxidant capacity or detox phases or even reducing or impacting inflammatory pathways, right?
And I
So
think
this is
that's amazing. I'm sorry. I think that's amazing when it comes to the course, the platform, because in so much in functional medicine, people just assume, oh, you give a curcumin, it's good, it's an anti-inflammatory, but there are specific ranges you want to stick within to affect a specific physiological outcome. So I think it's wonderful that you
yes.
have this. Yeah.
Yeah, absolutely. And it's so when we dive into more of like a functional integrative approach and we look at treatment protocols, it's really important to understand there's several factors that we look at, right? It's first of all what agent compound is beneficial, but then the dosage, and the dosage is going to be different per the not only the condition, right, but also for example, per what you're trying to do physiologically, right? So in terms of the root cause, so we look at the condition, we look at the symptom, we look at the root cause, and what is it that we're trying to do, right?
Mm-hmm.
Now I also really love the recommendations that you brought up, which is to using immunoglobulins.
Mm-hmm.
This is something that I've kind of looked at the last few years, and it's really interesting. And essentially, what it does, it really kind of target through the gut, through
Right.
modulation of our gut. It also impacts systemically the immune activation. So
Mm-hmm.
that's really, really interesting, and it has been showing to the immunoglobulin protein isolate has actually been showing to support healthy digestion tract and immune function. And it works by binding to the antigens in the GI tract and blocking them from crossing the gut barrier, right, where they have a systemic impact. So this has been around for a long time. So it's not that I just discovered it yesterday, right? This has been around since the 1970s. Been tested, has been in utilized in practice in some capacity, but it's really in the last few decades that we've kind of gotten better and better products that have a good profile of safety and effectiveness. So let's take a look at one of those products. And again, just to mention, the American Academy of Functional Health we're not affiliated with any of those vendor companies or lab companies. We do our own research. We look at our own clinical experience of what works and what doesn't, and then we are here to coach and educate you so you can get better clinical outcome. So this is a Mega IgG 2000, and essentially it's a lactose-free, casein-free, and beta-lactoglobulin-free. This is a unique formula that's really designed for a healthier mucosal immune system. And it's really here. Remember, this is not designed to replace any medication. This is not designed to treat any disease. This is really focusing on binding, right, to binding the antigens in the GI tract. And this is really designed to support a healthier immune function and healthier gut barrier function. So this particular product has been a subject in over 10 published human clinical trials. We typically don't recommend something unless we know that there's an evidence beyond clinical experience that it works and it's safe. There's several studies that have looked at this particular product. And so this is one you can take a look into and check out a few of the studies, among them published in the Journal of Clinical and Experimental Gastroenterology and the Journal of Gastroenterology and Hepatology from 2014 and 2017. And there's several other studies that talked about this. The dosage, of course, there's multiple dosages, and we're not going to get into the dosages because it might be a little bit different depending on what it is that you're trying to achieve and for what specific chronic condition, right? But here's one citation. You're welcome to read more about it, right? So as usual, we try to end our class with not just some practical application, right? Or you can utilize it already tomorrow with your patients, but also give you recommendations of like simple tools like supplements that patients can utilize to reduce the autoimmunity, right? So let's finish up with answering one of the questions of the viewers, which is where can patients, when considering ALKA test, when can patients get blood test or a blood sample, right? If they don't have a phlebotomy services in their practice, or maybe you have a virtual, like a lot of our practitioners in our community, when they come to see us, they do a virtual practice. So they don't need a receptionist, they don't need a big office, they don't need all that expenses. You only need a laptop and internet, and we help guide you to everything else. So a couple of recommendations that I have, and Dr. Esha can also kind of provide her additional recommendations, is in my practice, we had a phlebotomist, a full-time phlebotomist. But when you don't have that, and if we are doing virtually, so we had patients that, like, let's say they're 2 hours or 3 hours from us, it doesn't make sense for them to drive if we're seeing them virtual, like a telehealth, right? So what we did is we simply reached out to a few phlebotomy companies, and we asked them to provide us with a preferred rate for our patients. And I think we negotiated down to like $35 or something like that per blood draw. So then what happens is the patient gets their lab kit shipped to their home, and then we call the phlebotomy services and say, this patient just got this lab, and we would send them the requisition form. We would put it in the box with the shipping, or just fax it to the phlebotomy services. And then they would drive to the patient's house. They would do the blood draw. They would take everything, package it, take care of everything else, ship it back to the lab. So you can do that. Just Google phlebotomy services in your city or where the patient is located in, and they'll take care of that for you. Anything you want to add to that, Dr. Esha?
I was going to say the exact same thing. That's what I do here, because being virtual, being remote, you have to kind of find other ways, but there are a lot of mobile phlebotomy services and kind of groups you can contract with. So, yep, that's exactly what I do.
Yeah. And I've got to be honest with you, when we go into, this is more of like a pro tip when you go into practice building, I always tell practitioners in our community when they grow their practices, there's only really, when you focus on growing your practice, there are only two things you want to focus on. One is developing your clinical skills so you get better clinical results, like patient care. Just the first one is just patient care. The second thing is growing your practice. That's the only two things you want to focus on. And that's really the two things we focus on in our advanced and clinical functional medicine program. That's why you have a mentor. That's why you have a business coach. That's why you have practice building classes. That's why you have the phone app with all the protocols, which are, by the way, coming out on Monday. So, that's why it's so important for us to have all those clinical tools, right? and just focus on delivering the best service and offering and growing your practice and income, right? So anything else you can outsource, like phlebotomy service, do it. I'm telling you, as somebody who we had the money to pay a full-time phlebotomist because our clinic was very profitable, but it was still messy, like because it required a treatment room. We would always take a treatment room. Sometimes it was quick as 5 minutes. Sometimes it was like 15, 20 minutes because the patient has to be lying down and they needed some water and, and all that stuff, right? It was also dealing with the shipping and, it was just don't do it if you don't need to. Have a virtual practice or an in-office practice in which everything else is outsourced. That's just a pro tip for you. So yeah, and if you want to learn how to grow a successful practice beyond functional medicine, clinical application, reach out to us. We got a really cool program starting with Dr. Chill, Practice Accelerator, which we'll be happy to kind of mentor you and give you all the strategies. And you have amazing clinical mentors like Dr. Esha. So book a call and let's help you build a successful practice. So Dr. Esha, I really appreciate you putting together our class for today and sharing your clinical experience.
Of course. I hope that it was useful. And I thank you for taking the time and kind of deep diving on the topic today.
Yes, it was awesome. And a lot that we talked about.
Yes.
So this was great. I really enjoyed it. And I want to thank our media team and Jacob for putting all of this together and allowing us to be with you wherever you are and producing this class. And I also want to thank each one of you for being there for your community members, for investing time, effort into developing your clinical skills and being there for your patients, right? So I really want to thank you for being there, being kind of like their guiding light during their time of suffering and need. So I really appreciate all of you. If you got questions, reach out to us. We're here to help. And I hope you take care of yourself. Have a blessed evening, and we'll see you next time.
Bye, everyone.